Today on Excelsior TV, we're talking with Tammy Quinn, who is the Director of Data Analytics with Lockton Benefit Group. Tammy, thanks for being with us. When it comes to pharmacy, why is it so important that payers have accurate and speedy data at their fingertips?
I think data is important to all of us for the same reason. So consultants, health plans, employers, we all need to be able to determine what are the cost drivers within drug spend. Are the payers paying the claims correctly? So they want to know that they're paying claims according to their own contractual obligations. The plan sponsors want to know that they're paying claims correctly according to the contractual obligations.
Makes sense. Tammy, Excelsior Solutions and Lockton recently deployed your new RxSmart data analytics tool for pharmacy. What does RxSmart do for payers?
RxSmart, as a warehouse of data, contains nearly 40 million lines of claims. It's a great deal of information, and we've been able to make this as efficient as possible. We've normalized the importation of this information so that we can update our reporting capabilities faster than anyone has ever done this before.
I understand that you were able to normalize very large data files, which has been an industry challenge for a long time. How does RxSmart display this data so that payers can see what's really going on?
RxSmart gives us the ability to provide dashboards and various topics of discussion that you can move one from another based upon the direction of the discussion. Each dashboard contains a variety of charts and graphs. We can change the way that data is illustrated from either a chart to a table format. It has a wide variety of flexibility in how we show this information. But the important part is that each dashboard can answer a different question. So RxSmart enables us to beautifully illustrate visual representations of the cost drivers within a plan.
Okay, so you're saying it makes it easier to read and understand the data. Now, how do you apply it to help the payer make cost and service related decisions?
So we can use the dashboard functionality here to change the criteria selection to model a what-if scenario. For example, we can show a client what the cost impact would be for a 5% increase in their generic distribution rate. This information can also be used to help to fine-tune a clinical program that perhaps an example of one might be to address the misuse of opiate medications. RxSmart can be used to help to determine whether a narrow network might be a good idea for cost reduction. It could also be used to determine whether a 90-day retail program might help to reduce costs.
I can see how that would be very valuable. The data is specific to the client, right? So how much customization can be done for specific payer questions?
We have built a set of standard reports that covers 95% of what our clients typically ask us. The other 5%, we have the capability to customize. As long as the underlying data elements are there, we can customize a report to answer a specific question.
What about the differences between health plans and self-insured employers? And how is Excelsior Solutions using this industry-first tool to benefit their clients?
Our consultants can use this information to perhaps make a recommendation on either plan changes or increased communication for getting that generic distribution rate a little higher.
Now you're talking about a lot of data. What about the security of that data?
All data is received through a secure file transfer protocol. All data is maintained on a secure server platform, and it goes nowhere else other than that. Each file has been encrypted by the sender, and then we decrypt that and maintain that on a secure server that stays in the same place, never goes anywhere.
Special thanks to Tammy Quinn. It seems that RxSmart is truly an industry-leading tool. For more information on how RxSmart can help you keep costs down and make good plan decisions, contact Excelsior Solutions right away. We'll see you next time.